The doctor is in the house. Dr. Jeremy Wilson, Superior Health and Wellness, and well, I'm finding out stuff off camera we need to share on camera.
I know, a lot of people are talking about IV therapy.
I hate water, and you say I'm a good candidate.
Absolutely, yeah.
For an IV.
For sure. Yeah, one of the biggest things that we see is people have deficiencies, whether that's vitamins or even water, right? You know, how much do people just love drinking a bunch of gallons of water, right? And so we want some flavor with it, right? And so we need electrolytes, right?
So I'm not the only humanoid on the planet that doesn't care to drink water.
Correct. I think when it comes to beverages, water's at the bottom of the totem pole, for sure, for sure.
So IV, and that's something that's been trending a lot lately. People are wondering, like, how often should I be getting these? Is it a scary process? I've done it before, and it's not scary at all. Yeah. It's like a routine just appointment that you have. First of all, talk about IV therapy and what are some of the benefits of that versus just drinking a bunch of water?
Yeah, I mean, it's definitely becoming very mainstream, and a lot of people are starting to hear about it. It's a very simple process. We do hundreds of these in our clinics every single day. It's just a quick little poke into the skin, and we have a big yellow bag that sits above you. We call it a banana bag, and it's full of all the things that you'd be deficient in. And that's the biggest thing to get started is you have to find out what are you deficient in. And
how are we going to find that out?
We have to do a series of diagnostic tests and labs. And when you do that, you can figure out exactly what vitamins you're deficient in. And that way you'll know exactly what you can personalize these to the individual. And so you'll know exactly what this person needs.
This is not a standard drip bag.
Correct.
Of whatever's in there, but you take labs.
Yeah, we want to see what you guys are deficient in. We want to see what vitamins, what nutrients, what needs to be replenished in your body because we're losing all that throughout the day.
Can you give me truth serum? My wife would like
We don't know if we want that one.
Yeah, keep that one in the black box somewhere else.
But the benefits of IV therapy is the fact that it goes straight into the body versus like some of the other things that gets filtered.
Correct. So like most oral supplements that you're taking, oral vitamins, you're only absorbing about, they say roughly 15% of that. Right, so you're wasting a lot of that. It's just going in and coming back out of you, right? And so if you're doing an IV, it's going to go directly into
the bloodstream.
Right into the bloodstream, right into so your body's immediately going to start using that stuff.
Well, I ask you about electrolytes. What that word now is marketable in drinks.
Yeah,
I bought one this morning. But electrolyte is what?
So Gatorade's done a great job with this, right? So
Everybody knows about it.
Yeah. So this potassium, magnesium, sodium, those are the electrolytes that your body typically will burn up when you're using your muscles during activities and things like that. But every day to day, you're burning up your nutrients, and if you're not replenishing those, whether through your nutrition or some sort of supplementation, you're going to be deficient at some point. And that's what we're seeing with a lot of patients that come in and they're chronically fatigued no matter what they do, how much coffee they drink, they just cannot get their body back to the energy level that they want.
Where are you located?
We have two locations. One's here in Greenville on Wade Hampton, and we have another location on Main Street in Spartanburg.
Yeah, so the important part is
that's great. I'm looking forward to this.
So the important part is to get signed up to get those panels done so they know what they need, and then they can come and get a system. You say once a week is the time you can do that.
That's the typical ideal scenario is once a week. Again, the biggest thing is to get the panel done, and that way also what we're finding now is we can actually use their insurance as well.
And that's
so
big.
Yeah, instead of coming out of pocket $200-300 every single week, we're able to leverage what we know with insurance companies and how they work. And we kind of beat them up a little bit and say, hey, this is necessary for our patients to get well. And so we're using people's insurance, and so that's a huge benefit for people.
That's a big deal.
Yeah, absolutely.
Do you take Medicare?
Yeah, absolutely.
Well, that works.
All right. We'll see you soon then.
I'm coming to see you.
Yeah, I like it too. It's a lunch break, get a magazine, check your emails while you're doing it, and then you're back at work feeling great.
Yep, feel amazing.
If I feel a whole lot better, I may not retire.
There you go.
I have to beg for my job.
You always got to cheer for it, Jack. You know that. Superior Healthcare, the number is on your screen. We'll be sure to put it at our website, yourcarolina.tv as well. Thank you, Dr. Wilson. Appreciate it.
Thanks,
Absolutely. Thanks.